Hello teacher, my name is Nicolas Gonzalez and the subject that I am going to talk about is the shock. Definition. Shock occurs when there is not enough blood and oxygen supply to your organs and tissues. It's a life-threatening medical condition as a result of insufficient blood flow throughout the body. Description. It is a very dangerous clinical condition for the patient. It is a complication of internal or external causes. It has to be controlled immediately. It is very possible the appearance of important sequels if it is not treated in time. He who suffers might be in danger of death without his due treatment. Type of shock: cardiogenic shock, hypovolemic shock, anaphylactic shock, septic shock, and neurogenic shock. Cardiogenic shock to heart problems. Hypovolemic shock caused by too light blood volume. Anaphylactic shock caused by an allergic reaction. Septic shock due to infections. And neurogenic shock caused by damage to the nervous system. Symptoms: confusion or lack of lucidity, loss of consciousness, rapid and sudden heartbeat, transpiration, pallidness, weak pulse, accelerating breathing, reduction of the flow or total detention of urine, feet and cold hands, and cold sticky skin. The signs of the shock: they vary according to the circumstances and include, among others, the following: cold sticky skin, pale or ash-colored skin, fast breathing, dilated pupils, weakness or fatigue, dizziness or fighting, changes in mental state or behavior, and such an anxiety or agitation. Cause of shock: the cause will depend on the type, the shock, or problem present by the patient, usually associated with acute myocardial infarction, congestive heart failure, or arrhythmias. Associated to a great variety of medical and surgical disorders such as traumatism, digestive hemorrhages, gynecological and vascular pathology. Consequence of exposure to a sensitive substance such as a drug, a vaccines, certain foods, an allergic extract, a poison, or a chemical substance. Infections in the bloodstream caused by infections of the body. Consequence: many organs can be damaged as a result of this. Shock requires immediate treatment and can get worse very quickly. Up to 1 in 5 people who suffer shock will die because of this. Shock treatment: general treatment ensures permeability of the airway, adequate ventilation and oxygenation, and optimizing circulation, toxin fluids and drugs. Specific treatment: stopping the bleeding. If the shock is caused by bleeding, this should be stopped by applying adrenaline, raising the injured person lips, pressing of the appropriate point, and if necessary applying a tourniquet. Pain control: a relief of pain by healing and correct bandaging of the wound or splitting the fracture and placing the wounded in a comfortable position. Oxygen: keep the air duct clear. Oxygen must be given by month to month breathing to combat anoxia, lack of oxygen in the tissues. Mind breathing and heart action, hair massage at an adequate level. Loosen clothes. Loosen the clothes around the neck, at the waist, and in the other places where you take them. Until the laces of the shoes boots without tightening them off so as not to expose them to the cold. Patent position. Put the patent in the dorsal decubit position by raising the feet higher than the head. The position helps the blood flow to the heart and brain. When there is an injury in the chest or in the head, keep the body resting on the back. Do not lift the feet. In the patent is unconscious. Keep the head hanging so that the mucus and saliva leave the mouth and do not flow on the track. Encourage him to take charge of the situation and by the confidence that you have in yourself and your actions by demonstrating to the injured that you can know what you are doing. Thank you.